y'all. I hope you're having a fantastic day. Thank you so much for joining me. Today is the first ever Mast Cell Awareness Day, and I am super excited and pumped to be raising awareness. Mast cell plays a huge role in my life and all my medical complexity stuff. So, for anybody who is unaware, mast cells are a type of blood cells that plays a key role in your immune system. So, they're found literally everywhere. They're found in your bone marrow, in your tissue, internally, externally. So that's like your GI tract, but it's also found in like the lining of your airways, in your skin. They're everywhere. So this is an immunological condition where excessive amounts of inflammatory chemicals respond to triggers. So like the trigger could be like, say, peanuts, and then your body throws off, instead of just like a couple chemicals, tons of excessive amounts of, like, say, histamine and other stuff. Some believe that there's an autoimmune factor to this syndrome. There's some pretty good evidence, however, nothing has been completely solid. There's a lot of questions still around mast cell. So one day I really want to take an in-depth look with y'all at mast cell. I want to do my own mast cell 101 video because I feel like it would be super valuable and really important to kind of like add my voice to like that mix, because I feel like there's not enough awareness about mast cell just in general. So, but for today, I didn't really have enough time. I found out about this awareness day a few days into October, and it's the 20th, the awareness day, and I had a lot of appointments and a ton going on with my health. So this is just going to be a short random facts video. So I really do hope, though, that you find value in this video and that you learned something. So mast cell, like I said, plays a huge role in my life. So let's just jump right into the random facts, y'all. Mast cell was first identified in 1991. However, it did not get the name mast cell activation syndrome until 2007. Mast cell is currently listed as rare, but that's actually not what they think. They don't think it's actually a rare disease. They believe, in fact, it's only rarely diagnosed. So in comparison to being a rare disease, they actually think that mast cell activation syndrome affects about 14 to 17% of the American population, which translates to about 1 in every 6 to 7 individuals might be affected with mast cell activation syndrome but have no earthly idea. And mast cell, just for perspective here, is a disorder / disease that is on a scale. So like there's a spectrum. You could have really mild mast cell, or you can have more like a complex, difficult to treat, difficult to understand type of mast cell. I feel like maybe there's a lot of research obviously that needs to be done, and they need to determine, are there like maybe different types, and a lot of other things. There's tons of more questions than answers, which happens with zebras. It is a systemic disease, meaning it impacts multiple systems within an individual's body. A lot of times, like just about every system is involved in mast cell because mast cells are found throughout the body. So the actual cause to mast cell activation syndrome is unknown. However, they have a lot of theories of what may contribute to it. We do know for a fact, though, that you cannot catch mast cell. I'll say that again for y'all. You cannot catch mast cell. So there's no reason, to act weird around a mast cell patient. But they feel that there's a combination of like hereditary type factors and environmental factors. Getting a diagnosis of mast cell activation syndrome can actually be pretty tricky for a number of reasons. A lot of doctors are not familiar or not as familiar as they should be with mast cell activation disorder or syndrome. There's no actual like definitive test, but there are like a bunch of different tests that can potentially be run. I will try to link them in the description. It's actually really interesting. There's like different blood tests, urine tests. Some say bone marrow biopsy to rule out mitosis is necessary. Others feel it's not necessary. you can argue either point, I feel. Additionally, mast cells release over 200 mediators, and there are less than 10 mediators that are specific to mast cells that can be measured through blood work. So you have all these mediators, but only a couple of them, like we have labs that actually pick them up and like that we can understand what's going on. So there are a lot of different diagnostic like criteria, so to speak, for mast cell, but all diagnostic criteria include these 3 umbrella type things, like not really objectives, but I feel like there's a better word, but we'll go with it. So you need to be having recurring symptoms of like mast cell reactions, stuff like that. If they're able to do blood work and you have, like, say, a positive tryptase, that is in your favor, or just evidence that you are excessively throwing off any of the mast cell mediators, if they're able to catch it either in labs or urine, good thing. And then, in addition, patient positively responds to mast cell treatment, which would be antihistamines. Let's talk a little bit about reactions. So the hard and frustrating thing with mast cell activation syndrome is that our reactions can change. What's safe today might not be safe tomorrow, but it might be safe Thursday. Who knows? Are you willing to find out? I'm not usually, if I'm honest. So what an individual reacts to today can and likely will change. What is safe today may not be safe tomorrow, and that's the bottom line. There's a lot of reasons why this is the case. There are actual reasons why our body kind of like changes reactions. My advice though, if you are a mast cell patient and you have like say a really severe and serious reaction, I say keep a list of like your severe ones and stay away from them as much as humanly possible. I do have severe triggers like say showering. I can't avoid showering, all of the time, but I space out my showers, to kind of accommodate the allergy. Other things, though, that, like, I don't necessarily need, like Sour Patch Kids, all went in the trash. So, a reaction can start immediately, like within seconds to a couple minutes of being, like, exposed to an allergen, or it could be a super delayed reaction, and it could be 48 hours later where you're getting a reaction to something you were exposed to. Like that, y'all, is just mind-blowing. Like for me, it's so hard to wrap your head around. Like, so this is why, though, the combination of everything is why it's really hard to keep a list of triggers, but it is vital. It's fundamental, y'all, for your health. So try to keep like a little bit of a diary or like a list or something. So this was really an interesting fact for me. Mast cells are involved from healing from trauma or stress. Who knew? Seriously, I was like, man, that is why my healing is so slow. I have like all these things against me, people. So, 75% of individuals with mast cell activation syndrome report a decrease in quality of life. And I thought that was quite astonishing, that number. I don't know, I didn't quite think it would be that high, but it does make sense to me. I mean, like, you do kind of live with that, almost a cloud of doom, I feel like. Some days the cloud is heavier than others, like, not like you don't really carry a cloud, but like it's kind of like always hanging over your head. Sometimes it's closer than others and you feel like the storm's gonna hit you like a cartoon, because there's always that possibility that you could go anaphylactic at any time. Like anything can really make me go into a mast cell reaction. Anything can trigger that. Anything can trigger breathing problems. So I understand why quality of life decreases so much. There's a lot of anxiety that goes with it, and I wasn't necessarily like always feeling super anxious until like more recently with the Theo and stuff. But there's a lot that goes into having a chronic disease that like you don't necessarily always think of. So, another super interesting fact, gastrointestinal symptoms are frequently the most debilitating in mast cell activation syndrome, and in some cases, the most dangerous. Who knew? When you're dealing with anaphylactic, though, your GI tract, guys, is actually involved. It's very interesting. So, like, in addition, like, we think, at least I do, like, anaphylactic, like, you can't breathe, you're, like, tight here, like, in this area. That's where, like, I think mouth, swelling here, all that good stuff. But, not good stuff, you know what I mean? Moving on. All that jazz. But, we don't always realize that when you're in anaphylactic, that your GI tract can be involved. You can be vomiting, you can have diarrhea, you can have bloody stool from mast cell activation syndrome. When somebody told me that, my mind was blown. Seriously. Water. Because I'm still feeling my last reaction. I'm like all swollen, people. Alrighty. So, last but certainly not least is treatment, because we want to know what can be done for this hot mess. So, treatments include a variety of lifestyle changes. Some might include diet changes, obviously avoiding your triggers, and carrying rescue meds like a maniac everywhere. And then there are different medication options. I do want to, though, note, y'all, it can be very difficult to treat mast cell activation syndrome. So different mast cell stabilizers, I'm just going to read them to you because nobody memorizes all these meds, people. So we have mast cell stabilizers such as cromolyn, which I actually have cromolyn here. I will show you what that looks like. These are cromolyn, and I put these personally in tea. I can't tolerate it in water. I don't know why. I vomit it. So that's the deal with that one. We have H1 blockers, which is a type of antihistamine. That's something like Benadryl. And we have H2 blockers, which would be like famotidine. Leakrete inhibitors, which I will pop up on the screen for y'all because I can't pronounce that. And an example of that would be like Xolair, non-steroidal anti-inflammatory drugs, corticosteroids, IVIG, Xolair, and other medications might be used for like symptom management. So if you're dealing with like depression or anxiety, things like Cymbalta might help, or Buspar. And then like if you're dealing with a lot of like chronic pain and stuff like that, there's a lot of different options. Or if you have muscle nerve involvement, you could be looking at like muscle relaxers. So my point is there's a lot of different treatment options, but they're not all what you would expect. So some of it is symptom management because mast cell causes tons of symptoms. So I would like y'all to tell me in the comments if you learned something, or share with me a random mast cell fact. Let me know if you're a mast cell warrior. Make sure to wear your purple today, which is Tuesday, October 20th, for Mast Cell Awareness Day. Also, please share this video to help raise awareness. Also, like and subscribe because that also helps to get the video out there, and this way more people see the video, therefore we raise more awareness. So I hope you guys enjoyed this video, and I do hope with all my heart that you learned something. Have a fantastic day. Bye.